Hi everyone. Today we are here with another role play. The setting is mental health clinic. Here, the nurse is talking to a 45-year-old project manager who's going through depression and is not able to perform well at work. So his employer has referred him to our clinic. So let's see how it goes. All right, we'll start the role play.
Okay.
Your time starts now.
Okay. Good morning, Thomas.
Good morning.
Thomas, I know you have to see the doctor within 15 minutes,
Yes.
but I have some notes about you, and I'll be the one first who's going to assess you, and then we're going to send you to the doctor. Is that fine?
Yeah, that's fine.
Okay. So it has been said from your case note that you have been referred by your company's employment assistance program
Yes.
because
that's
you
right.
need some help,
Yes.
and it has been said that you have missed few business meetings.
Yes, recently I
Mm-hmm.
have developed anxiety
Mm-hmm.
and I'm not able to concentrate properly on work.
And it even shows that you are inconsistent with showing up to work.
Yes, sometimes I don't feel like going out. I
Mhm.
just feel like sitting in my room or on my living room in my sofa.
Okay, so if you don't mind, Thomas, I would like to ask you some questions about you, about your work life, about your family, just to know more about you, like what's the major problem with you. That's all. Okay, if you
Okay.
don't mind, may I ask you some questions?
Sure, you can.
Okay, so the first question that I would like to ask you is that is how you have been feeling last few weeks regarding your mood.
Well, I was not feeling I mean, I'm not getting any interest in doing any activities.
Uh-huh.
Earlier, I used to work for like 12 to 15 hours a day. Now I don't feel like going to office.
Okay.
And I was getting stressed out
Okay.
even after working for a few hours.
Yes. So that
So-
means what I understood is that you are lacking a sort of energy,
Yes.
isn't it? So how about it? So about your energy levels these weeks or maybe these days, are you feeling very active or you lacking energy or you're feeling something is drained up and going,
I
something like
feel
that?
very drained because
Mhm.
I used to go for swimming and playing with my kids, but
Uh-huh.
now I'm not able to go for all that because I'm getting tired really fast.
Okay, and the next question that I would like to ask you is regarding your sleep. How is your sleep?
Well, yesterday, I mean, last night, I woke up in the middle of the night around 4 a.m. And couldn't sleep after that, so was watching some series.
Okay, okay. And what impact this has made into your family life? Could you please tell me more about your family?
Oh, yeah, my wife passed away last year.
I'm so
in a
sorry
car.
to hear that.
It's okay, in a car accident. And I have two kids.
Okay,
My son is 15 years old and my daughter is 13 years old.
okay.
Okay,
And how are you with them and how are they with you?
well, these days I'm not able to spend time with them because I don't feel like doing it.
Okay, I certainly understand. At times we do feel low. And how about your work? How are you able to cope with your work and about the situation around there?
See, after my spouse passed away, I engaged myself in work most of the time, so that I didn't even get time to grieve on her dismay.
Oh,
So, but see, these days I'm not able to concentrate on work. Maybe because I was giving a lot of I was getting a lot of pressure from work,
Okay.
and I was working for like around 15 hours a
Hours a
day.
day. Okay.
And now I'm just drained. I'm not able to concentrate on work.
Concentrate in your work. Okay. And
So,
then
and
Mhm.
I've been Googling about my symptoms, why I'm not able to be active. And I saw that I might have a depression because all these symptoms are suggesting that. So, is this a depression?
First and foremost, Thomas, we cannot come up with a definitive diagnosis by saying that you are depressed because the doctor is the only best person to diagnose you and tell you what it is. Because most of the times we all have a tendency to Google things up and finding out our symptoms. But as I've heard, the thing what I've understood from you is you are lacking a little bit of energy, and your wife passed away last year, and you have been having a lot of responsibility in your shoulder, and you're not able to work life balance, you're not able to go on with that.
Yes.
So I certainly understand from you. I have another 2 more questions regarding this, and after that I will explain to you in detail. Okay. Is that fine?
Yeah, that's fine.
Okay. Are you engaging into any social activities or anything like that? No. And have you any time thought about self-harming yourself?
Oh, no, never, because my kids don't have anyone else if I do something like that. So I've never thought of that.
Good. That's a very good thought that you have given. And don't worry, we are here to help you out. And as I told you earlier, you told me that you had Googled and you found out that you're having depression.
Yes.
Depression has a lot of other symptoms. These are not enough just to say that you are having depression. So that's what. Let the doctor talk to you. He will analyze you and he'll come up with the final conclusion. Is that fine?
Yeah, that's fine.
Yes.
But is there anything I can do to come out of this?
Yeah, there are a lot of things that we can do so that you can, come out. Here we have a lot of the therapies, a lot of activities, lot of de-stressing methods, a lot of things are here where we help the patients or anybody who's going through a very stressful situation to come out of it. Definitely, I will include you into it.
Because if I continue like this, I might end up losing my job and I won't be able to support my family.
I do understand that. I really understand. See, if I was in a situation, I would have also felt the same way. But you are holding on to yourself, and I should appreciate you for that. So when it comes to, thinking about losing your job, don't. If you need to take a break, I'll write a letter so that you can, take rest. You can sit at home for some time, get yourself okay, and then you can start off with your work. How does that sound?
That sounds better.
That sounds better. And here we have depression support group, and we have short-term medications. A lot of treatment options are there.
So do I need to take medicines?
Some medicines so that the stress will be reduced. That's fine?
Yeah, that's fine.
Okay. So once again, Thomas, don't worry. You have come at the right center, and we are here to help you out. Okay. So all these problems, we don't know what it is. Only the doctor can diagnose you in a proper manner. We have a lot of, supportive measures, treatment modalities. And if you want, I'll write a letter so that, you can take a little rest and you can be at home and chill and relax for some time. Okay?
All right.
Okay. Anyway, thanks and nice to meet you.
Thank you.
Okay. So this is the explanation for this role play. Some important things that you need to keep in your mind. So if you can see in the case note, the first task says a lot of things, okay? That is, we need to ask about the mood, we need to ask about the energy level, we need to ask about the sleep, how it has impacted his family, his work, right? There were a lot of questions in the first task, and that's very important, and that is very crucial that you ask to the patient, because he says he's depressed, but we need to know what is his real problem. See, when we asked a lot of questions, we came to know that he's not working properly, he's not attending the business meeting, he's not paying much attention to his kids, right, Georgina?
Yes.
Yeah, his wife died 1 year back. See, so many questions we could ask him. So it is very important that you see from your task, if they are given all these questions, you need to ask. Okay, so this is something very important that you need to keep in your mind. And the second thing is, most of us, including us, we have a tendency to Google out our diseases, right? So it might be, the patient might be telling that he had Googled the disease and this is it. but we do not know what the disease is. Only the doctor is the right person to judge you and tell you what your definitive diagnosis is. So please do not nod a yes, because only the doctor's role is that to do that. Okay, so you need to keep that also in your mind. So when you get these type of role plays, keep these things in your mind and move forward with your role play. Okay.